just wheel myself over. We are back. We have IVs in. Beth just came off of vacation. I am coming off of, surviving motherhood, so we are all worthy of an IV, right?
So we decided, let's do this chat while we have a detox. Kendra's already finished her IV. We started a little bit early, so Kendra's now getting a glutathione infusion, and I'm still working on my detox. And
Let's talk about glutathione, because
that's pretty amazing.
I know. That's like a huge thing that I swear by. Okay, so glutathione, because this is something that my mom does every month now, because she'll come, when she's here, she'll come to you for it. Mm-hmm. So will you explain a little bit of what it does?
Yeah, so glutathione, you can get it as a shot, you can have an infusion, you can take glutathione orally, it just doesn't work as well with gut absorption, so it is better either IM or with an IV infusion. So we just usually piggyback it and run it after you do one of our bags. It's quick, it's easy, it pushes very fast. Glutathione is amazing. I think we talked a little bit about it last time. It's an amazing antioxidant. We produce a lot of that breakdown naturally when we're younger, and we lose it as we age. It works very well for anti-aging. It helps with weight. It helps with energy. It helps with sickness. It helps build muscle. It just works well with other antioxidants for overall improvement in the body's homeostasis. So you just feel great.
So you have the detox bag.
Mm-hmm. Yep.
What's in there?
Yeah. So we did the detox, which is our recovery blend. Lots of vitamin Bs, which are amazing for energy, detox, weight. Vitamin C is in there, amino acids, and a few other elements and just the fluid. So coming off of a week, spring break with the family, we ate poorly, drank, so getting ready for the week, you can pregame before you go on vacation, you're pregaming before your day of day drinking, and you can detox on the way back. So we
cool.
did. Yeah.
Cool. Okay, so last time we all met, we talked kind of heavy into hormones and gut, and that's kind of the baseline for a lot of things. So maybe today we can hit some of these peptide questions, talk more about the variety of peptides and things like that. Do you want to start with questions or just kind of general stuff?
Yeah, do you want to answer some questions?
Okay.
I had quite a few.
So a lot are related around periods, about periods being more intense as you've gotten older. Is that a thing? I was telling her some of these questions, my periods got progressively more intense the more kids I had. So I don't know if that has to do with age, because I'm older every time I have a child, or that I had 3 kids in 4 years.
Right.
So period intensity.
So I think one of the things I would really mention, because there's a lot of questions, and I hear it every day on hormones, and with menses, perimenopause and menopause are not put into a box of all of a sudden you turn 40 and you start with perimenopause, and menopause starts at 50, and that's just how it is. So women can go through shifts of hormone cycles. Even perimenopause can start earlier in their 30s, and it can go on for a really long time, but it's not just about the hormone imbalance. A lot of other things could be happening in the body first, which are leading to the hormone imbalance, such as we talked a lot about gut health and mitochondria and cortisol stress and keeping, unable to lose adipose tissue, which estrogen lives in. So there's just not one answer, but it's typically dealing with checking the hormones and seeing, is there an estrogen dominance happening, which is causing the heavy bleeding, or progesterone that's really low.
That was mine.
Your progesterone was really low, right?
Really low, yep.
And so often if you start bioidentical progesterone, not birth control, but bioidentical progesterone mid-cycle on days 14 through 23 at bedtime, it helps really balance out the menstrual cycle. And again, improving all the other accesses of the body that we've talked about in our first chat, the hypothalamus, the adrenals, the gut, the mitochondria. I mean, improving all those things has a lot to do with your overall improving hormone imbalance. Estrogen dominance, we usually fix with ester factors with DIM is one product we use, but just eating a lot of sulfur-rich foods that have DIM in, it basically helps with that first phase of estrogen detox that's coming
What is
through.
DIM? I've never heard
Yeah.
of that.
So DIM it's a breakdown of, so sulfur-rich
Gotta
foods
add that to
can
my
be,
notes.
yeah, I know, DIM, yeah. DIM, it's, an herbal breakdown, you can get it from foods, and like I mentioned, sulfur-rich foods contain DIM in them. A lot of green leafy vegetables, kale, broccoli, things like that will have a lot of DIM. But yeah, Google and read about DIM. It does really help push estrogen through, because estrogen, if it's not getting recycled, causes a lot of problems in the female's body. So, and men too, men can have estrogen dominance. So, but yeah, as far as just menses, and you can have heavy or amenorrhea where you're not bleeding. And the biggest mistake I typically see, if I can get a woman before they just reluctantly have given up and said, my gynecologist just wants me to go and get a hysterectomy because there's just nothing else we can do, and IUD's not working. Please come see me, or find a functional medicine provider that is, or just somebody who is really working on the management of the hormones and all the other things before you take out parts.
I've heard several people want to look kind of beyond their gyno, because their gyno is just
Have a hysterectomy, and it still doesn't fix the problem on why the imbalance happened, and it's just the way it is. I mean, you can leave the ovaries, but you still will push yourself into early surgical menopause, because once you take the uterus out, you've cut the arteries, the veins, the nerves, the uterine sides.
And that's something that I have learned is in medicine, functional doctors and places, they look for root cause, where medicine really fixes symptoms.
That's right.
And
that's
so
the way
they
to look at it.
Yes, so they know that the hysterectomy will fix this symptom, so that's their solution, whereas you dig much deeper into finding more of a root cause,
Right.
and you have more of an interest, which takes more time.
Yes.
So you're taking more time with me to figure things out, and a lot of it's trial and error. Like, okay, here's what your test results are. Let's try this and this first, and then if we know that might level out my baseline for progesterone or something, and then we go back. So that's something that I've noticed a tremendous change, because usually people just fix symptoms.
Right, and really when you fix, I don't mean to beat a dead horse, but you'll hear us talk a lot about that. When you fix the gut microbiome, that's a good 60% of the problem right there, because a lot of hormone conversion doesn't just happen in the ovaries and through the endocrine system. So when you fix the gut and the gut microbiome, and a lot of that is food sources and other supplements, and you fix the mitochondria, amazing cells where all your sex hormones get converted through there. So when you fix the processes in the body that are disrupted, then often, and again, sometimes it's just a simple, here's bioidentical progesterone mid-cycle, in addition to these other efforts, and then bam, your cycles end up
Everything else can function the way it should.
Yeah.
I'm gonna talk a little bit about some aesthetic stuff. Hair, skin, nails, yes. So that, especially, I'm in my mid-30s, and those things bother me big time. My hair, I know my haircut made a big difference, but my hair has changed on those peptides.
Yeah.
It has thickened up, like, I'm not gonna say 50%, because I think that's dramatic, but like a lot.
It is
a lot, yeah.
And that's right when you got your short haircut too. That's so adorable.
Yeah, I cut off all the dead, straggly stuff, and so I totally changed. I totally changed everything. But if I hadn't started the peptides, I don't think this cut would fit my face as well. Like, I really started to fill in those gaps from having kids.
Yes.
And breastfeeding, I guess, right?
Yeah.
Okay.
That's right. Mm-hmm.
Yeah.
Yeah. So we talked about CJC is a peptide that works a little bit more. It stimulates your growth factor a little bit more than other peptides, a little bit more anti-aging, but also stimulates other peptides to work better. And so the two that we use most often are CJC and BPC 157. BPC 157 It helps with weight loss, and it's an immune modulator. It's just an amazing peptide that works for just about everything. It helps with the gut. It helps with wound healing. So
In my back injury.
yep, your back injury.
Yep.
So pain syndromes are a big one. We've had a couple patients that they say they were almost ready to schedule for a laminectomy, and we started BPC 157 and CJC and kind of injected around where the herniated disc is, and her pain is gone, the radiating pain down her leg is gone. So yeah, BPC is just a go-to for many providers use BPC 157. Another immune modulator that I love is TB4.
Yeah.
So that's, Thymogen, Thymosin, some of these other peptides that were on the market and worked really well have been taken off, but TB4 is very similar to BPC 157 as an immune modulator, but also works a little different, and that can come as a pill or a spray. I love TB4 for my folks who have autonomic dysfunction, Lyme's disease, neuropathic disorders. It's building up the immune system that is otherwise broken, and so TB4 is just a great peptide. KPV is one I use that can also come as a spray, that's called the Barbie doll peptide.
Excuse me, what?
The Barbie doll peptide. So it helps produce melanocytes and can help with weight, helps with hair, skin. So KPV is another cool peptide.
And that's a spray, you said?
You can do it as a spray, or there's oral KPV, Epitalin is one that tends to be kind of pricey, but you would only use it twice a year. And Epitalin is the strongest anti-aging peptide on the market. So you inject once a day IM, so it's an intramuscular shot, so you really need to come in for that. But for 10 days, and you would do that twice a year. So huge anti-aging peptide, Epitalin it's called. It's pretty awesome. Yeah.
Okay.
And I think, with hair, we were also mentioning the GHKCU copper peptide that comes as a foam for hair, and it also comes as a cream.
So I have been using that.
Yeah.
And I would have these like power alleys, just like these little patches that, can you see, like,
Yes.
You're
starting to grow, yeah.
It's definitely growing in, and I don't even need it to grow full length. I almost just need that shading. So that way it just, when my hair's pulled back, it's not like these huge power alleys. So I have been using it, and I can tell you that it's working, because I had like patchy bald spots for a while. Yeah.
And some of the guys, for men, I have a couple guys who've tried this where they have the bald spots back here, and they just were putting it on that area, and it's crazy that they grew hair in the bald spot to cover up. Yeah, so that's a great peptide for hair that's a foam, and then there's a cream that you can use on your face and your neck and your skin.
Yes.
That it helps build collagen and elastin and takes care of like hyperpigmentation.
So I've been using that on, and I don't have like a ton, but I have like this weird, just see how it's just like you can tell I've had some kids.
Yeah.
I've been putting it on there because it gets it just feels like very thin skin. I think that has been totally helping. The other thing is I don't have a huge chest, but I still sleep on my side, and I have those creases here, and it has been, and it's like 4 clicks I think you can use. So it's working. I know I don't have like a ton to show for it, but even my little things, I feel like it's made a big change. So
Yeah, I love that Kendra's willing to bare her belly. I will not. But I mean, I use it as well, and I've noticed significant changes.
Yes.
And even on like hyperpigmentation areas, and if you have it on your arm or your face, you'll notice that starts going away. So
anything for stretch marks? Would that work for stretch marks?
Yeah, it work for stretch marks. This isn't noted, but I think BPC would work for stretch marks too. Because BPC 157, I've injected it right around wounds where there's scars, and it just makes the scar disappear. So BPC 157 is another one. So yeah, peptides are just amazing. So many different things you can do. You can wash on, you can wash off. They you're not injecting with growth hormone, but they do stimulate your growth factor, and they just are amazing.
Yeah,
Yeah.
uh,
Energy, brain
yes,
power.
I'm telling you, like, I don't want to, that's a big thing of like brain fog, that some days I'll just wake up with like, it just feels dusty, I can't explain it. And I will do my morning injection before I take the boys to school. By the time I come home, I can like feel, like I get a little bit flushed and I can like feel it go through my body.
Yeah.
And all of that disappears.
Yeah.
And that's really what can prohibit my day if I'm just not like, my headspace doesn't feel, and it's like full clarity. It's kind of insane. Okay, another big question, we probably have it 6 or 7 times, is about bloating.
Yeah, bloating.
Bloat.
Yeah.
The worst.
So back to, you've got to fix the gut microbiome, and you've got to feed the microbiome, like good chlorophylls and green leafy vegetables. If you get gassy eating good foods like broccoli and cauliflower and Brussels sprouts, you've got a gut microbiome issue, and the bad bacteria is taking over. So bloating, we talked a lot last time about when you come to see me, if the gut is blown, one of the first things I want patients to do is detox off of gluten, dairy, and sugar for 30 days. Because
that'll fix a lot.
It does, it really does. You've got to just clean it out, and then really starting to eat well. And there's so many good resources out there. I feel like there's just more and more knowledge base about the gut microbiome, and we know more about it. So, and sometimes seeing a nutritionist can be helpful too, just to help guide you if you're at a loss on, I haven't eaten well for years, I don't know how to get started. But bloating, probiotics can be helpful for that. The B vitamins, like in our IV bags, and methylated B vitamins really help with the methylation process too, and help with the gut. And glutathione, I mean, just all the different things we talk about.
Okay, so as you are like rambling off all of these words that I don't understand, it brings me to a question that somebody else is asking is, how do you know, for people who aren't local, not all functional medicine, or not everyone is created equally. So how are we like vetting these people to say, okay, this is somebody who knows what we're talking about? Are we looking for certain credentials?
Yeah. I mean, not necessarily. I think it's just like in medicine, many of us, we have the same, like physician assistants, board certified, same thing, MDs, DOs, but I think it's just finding the person who you can relate to, who can answer these questions. Because I just the other week had a couple people come in that are seeing functional medicine provider in the area, and they're just getting hormone pellets, and it's a disaster. It's like going back to square one. So just because you're board certified doesn't mean that you're necessarily. So I would just go off of researching.
Okay.
I often hear that for folks who find me, where they'll say, I've just looked into you or your bio, and sometimes getting a referral from a friend is helpful, but we're not all the same. Same
That's
thing
the
in
name of the
medicine.
game.
We're not all the
Referrals,
same.
I think, are probably big. And something my mom told me when I was like really young, probably when she realized it, like you are allowed to change doctors and you are allowed to reschedule appointments, which it never occurred to me. Like I would be bending over backwards to show up to an appointment that really didn't work for, and when she was like, you're allowed to change a dentist appointment, I'm like, what? You're allowed to change a doctor.
Right.
Like if something doesn't work for you,
Right.
you can make a change, and it's good to try. You only know what you know, so you got to figure out and kind of shop around if you feel like you don't have the right match or the right pair, somebody who's not listening to you, or like you come in and you're telling me all of these different things, and you automatically, like one of my first visits with you, I'm like, oh my gosh, she's looking at the whole picture. It wasn't just one thing. And that's what it is. It's not just one thing. It's like, well, we got to do all of these things because I am one whole body. So yeah.
Yeah, and I think we have a question too. I mean, I have patients who see me from other places like Charlotte or Greenville, North Carolina, or a friend of mine, her sister lives in Michigan. And so we had some questions on a distance, you know, we can see folks out of state, but you have to come here to be on our soil in North Carolina to see us because of board certification.
Yes, initial visit has to be in person,
That's right. And but even if you live, you know, an hour and a half away, I mean, I even have folks up past Winston-Salem. You can, even if you get here for, you know, a physical once a year, some of these visits can be done through telehealth. So that we still can bill insurance for, which was one of the good changes with COVID, is insurance accepted that, and they still, you know, we're still allowed to bill. So that I do have patients that, if you're interested, I just know we had quite a few questions about being in Cary or just, you know, and again, I've got folks from Gardner, Fuquay, Marina, Holly Springs, I mean, just.
And I live right down the street, so you can come stay at my house and then you can come to your appointment. I'm not kidding. Because
Kendra probably really would.
No, I totally would.
And
And I have
honestly,
told people, I'm like, you can stay at my house, no problem.
Yeah, and you probably make this fantastic Filipino meal.
Well, I would like call in the Filipinos like for reinforcements because they're just so good at it. So I'd be like, hello,
Yeah,
here we go.
yeah, I
So
love that.
I would do nothing.
You're
but
so inclusive. She might even invite you to Thanksgiving.
no, for sure. We'll do a class together. We'll do some bars.
That's right. That's right.
Okay. Everybody is asking this about natural supplements or something stress and anxiety.
Yeah, ashwagandha root is amazing for stress and anxiety. It's really the only one off the top of my head, other than just general adaptogens like lavender oil, L-theanine, and green tea is a good. These are adaptogens that help calm you, help with the stress response. You know, you can put lavender oil by a diffuser at bedtime. Sometimes a good blend of, you know, CBD oil is okay to de-stress at the end of the day to help you sleep. Oxytocin, when you secrete your love hormone, that helps with generalized stress and anxiety and makes you calm down just a little bit.
Yeah.
So there's,
Okay.
But ashwagandha root's a really good one.
So all of these that you're listing makes me think of Four Sigmatic. Have you heard of that brand?
Oh.
It's like a mushroom coffee brand.
Yeah, there's some good mushroom brands.
Yes,
I didn't think
and
about
so
that,
all of those things, it's all about adaptogens and things like that. But you're also describing like a wind down routine.
Mhm.
So having, like for me, I'll turn on a salt lamp. I charge my phone in our bathroom, so it's not that decreases my stress like almost instantly. Kind of like the basic boring things that we don't really want to do because it would be much easier to like take a pill and not be
Yeah, that's right.
But it's
That's
true,
right,
but just like a wind down routine might help with all of those things. I'm a big fan of like CBD salve and things like that.
Yes. I think wind down is important for everybody. Meditation is so helpful. I mean, a lot of people don't understand the power of meditation and box breathing, but
Breath work,
we talked a little bit last time about high cortisol states and high stress, and you know, if you can just find 20 minutes in your day of going into a dark room, closing the door, meditation, the overall meditation even throughout the day helps with sleep at night, and box breathing is really helpful too. So I mean, all those things.
So that brings me to one time I came in, probably for one of my heart, I was having like weird heart issues, and you're asking me all the right questions about stress and things like that, and I'm like, I'm not that stressed. Like, I don't live a stressful life, but I am a stressful person. I can create a lot of stress. And she had said to me, she was like, you can justify anything you want, your body will always keep score. Do you remember saying that to me? And that, like, I felt it in my gut. I was like, oh no, she knows. And it's so true because I can just like plow through a day, just get through the day, just push. But like that stuff adds up. And so these kind of what feels basic of like a wind down routine, taking a shower, washing your face, having some tea, those types of things really help calm me down, because otherwise I just continue to wind up.
Yeah.
And then I end up, you know, in the back of an ambulance or something like that.
And I think we all live in this state of just high stress. I mean, it's just, and we just do. I mean, it's between the work, the day, and the shuffling of kids around. And I mean, it's a Saturday when we're filming this, and I still have about 10 things I have to do before we have my husband's birthday dinner tonight at 5. So
I know, it doesn't end.
it just doesn't end, and I think sometimes just giving yourself that break, and however that looks for you. We talked about that last time, is important, because cortisol, stress is just a big player in all the things we're talking about, and
Correct.
finding a way to manage that is just really important.
Yes, and it's allowed, and especially for moms, it's easy to just push it off to the next day, to write it off. Even like I feel guilt when I try to like take some time, and then I like feel guilt because I've left David with all of the boys and it's nuts and I can tell he's frustrated, and then I'm like, but this didn't even solve my problem, this made my problem worse. So like kind of just letting it go, like everyone will be fine.
Right.
I need to take 15 freaking minutes in my own day, like you're allowed to do that. Let's talk a little bit before we go into hormone replacement therapy, the trifecta, because you mentioned it, because I am on 2 out of the 3 trifectas, but I'm not allowed to be on that third one because you told me so. And when you said like, man, that's really like the money, that's the
It's
blend
a
you
robust
want,
treatment.
and I'm like,
Yeah.
but
So
my blood pressure is low,
yeah.
so you didn't want.
Well, that, and you don't really need, you didn't have the kind of weight to lose that some people do. So when Kendra's mentioning the trifecta, she's mentioning BPC 157, CJC epirelin, and semaglutide. And semaglutide is our GLP that if you don't have thyroid cancer, and we've screened you for that, it's the biggest contraindication to using a GLP, same thing with diabetics, then we use it for weight loss. It works amazing for folks. And sometimes if people can't afford the 3, we'll just use BPC with semaglutide. But the 3 of those together are really robust overall treatment where you'll lose weight, you'll feel great, you'll build muscle. They just work really well overall. And then you can get to a place where it may be that we wash off, or everybody's just a little different. Sometimes maybe just a maintenance of a shot of semaglutide once a month, or even coming off for a couple months and giving your signals a break and going back on. There's different ways to do it.
So, is semaglutide like Ozempic, and what are all those things that are like crazy
Semaglutide is not, so it's not, it's illegal. It's not exactly like Ozempic, but very similar to Ozempic. You've got multiple GLPs on the market. You have Wegovy, you have Mounjaro, you have Ozempic, you have Victoza, Trulicity. All these, they're all GLPs, and they all have a benefit to weight loss. And we use some of those specifically for type 2 diabetics. Semaglutide is a compounded form from a compounding pharmacy, and again, it is not a identical replica of Ozempic. And even not in its generic form, but it's very similar.
Okay, let's talk about hormone replacement therapy. There were a ton of questions about that.
Yeah.
And I had to ask you which HRT. I was like, what is it? Everyone's asking about HRT. What is that?
Yeah.
Okay.
So hormone replacement therapy these are not synthetic. It's not birth control. It's not an IUD. All the ways that we know how to prevent pregnancy, but they block your receptors and do not give you any benefit to your natural hormones. Progesterone is, you can get that in a capsule form through the pharmacy. It's made from plants. Same thing with estradiol, which is your most functioning form of estrogen, can come in a patch. And that can also be built through insurance. Testosterone for men, injectables, can be built through insurance. Sometimes I have women that do best on something called a Baez cream that's compounded, which is 2 forms of estrogen, and they just maybe didn't tolerate the adhesive very well.
Where are they rubbing that? Just like
all
over?
You pick a spot. It's typically subcutaneous, often on the glutes or the thigh, you rotator areas. But most of my patients that need hormones do fine with progesterone and estradiol, and sometimes we'll use an E3 cream vaginally, which your vaginal receptors, they I guess bind better to E3 than E1 or E2. A lot of women don't know your estrogen is broken into 3 different components. You may have heard about pellets. I do not do pellets. There are people who do. I just think you need to pick wisely.
And what is a pellet? Like a pill gets shot
It's
in?
you know, a small little capsule-ish. Looks like a pellet that a small incision is made subcutaneously, usually in the glutes. And once it's in there, it's a release. You can't control it. And it's sustained release over 3 months typically. So there's estrogen, there's testosterone, there's progesterone, but yeah, we don't do pellets here. So it's just probably, I just think it's harder to regulate once it's in, and
that's
like I said, I think are people getting, I have my patient who I had the other day who, first of all, a woman who is still having menses typically does not need estrogen in any format, except when you hit menopause and you're really estrogen depleted. And they're getting pellets, and her estrogen levels were 800, and her testosterone level was huge. And so the scary part is you have this over hormone production rate, so now you're at risk for cancer.
Other stuff,
and making you feel terrible. I mean, with that much testosterone, and testosterone converts into estrogen, you'll lose hair. And I just think there are some people who do Gradle pellets and have no problems, but you just have to be very careful with pellets and who uses them, and just trust in the provider that is giving, and this specific patient even had an IUD in it. I was like, those are the huge things that you would have never. So you're giving all this hormone, and with an IUD you block progesterone. So it just was a really bad combination that we're working on fixing.
Great. Now it becomes your problem, right?
That's right, but I love a challenge. So to fix that and make somebody feel better, it's my favorite reward for sure.
I believe it. And peptides can fix the gut. Peptides can help with energy. Peptides can help with weight loss. It's like in your hormones, like. There's a lot of questions in here that are like, what's the one thing that worked for you, for me? And if I had to say one thing, it's peptides really helped level everything, because we talked in the first video, I'm not sick. Mm-hmm. I'm just looking to feel better. I'm just looking to optimize a little bit more. And you may say I didn't have weight to lose, but I was tremendously uncomfortable, and we were talking about this off camera, that when you feel uncomfortable in your skin, I had a bad attitude, I had very little patience, I had very little motivation, I was just generally frustrated. And so that can kind of, send you off the deep end, because you're doing all the right things, you're feeling like you're supposed to be, going to the moon, and it just kind of plateaus, which can be really frustrating. And I do think peptides is what shifted the needle for me. Whatever it kick-started or toned down or whatever has been like the key to success for me.
Yeah, and BPC and CJC, I'll just sum that up. For some of my patients, anybody listening who's on them would agree to this, they really help with anxiety and sleep. It's really interesting. CJC especially helps with sleep. So you mentioned irritability and anxiety.
Let's get real. Like, I still cop an attitude, but just not as frequently.
But that's what we love. Yes. We love Kendra's honest, open candor, right?
Yeah, so I'm not like this, free-flowing, like, not a care in the world.
Yes.
But it's true, and the sleep. So I would wear my Apple Watch, and I was sleeping a lot. Like, I get into bed very early. I like sleep, but I was only getting like 3.5 hours of true good sleep. And with these peptides, I do not move. Like, I am out, I am sleeping heavily, soundly. And sometimes when that happens, you're groggy the next day, my eyes pop open, and I am like ready to roll. So there's no groggy or downtime where I feel like I'm so tired. It's like I sleep because, it's nighttime. Yeah. But I have energy up until right before bed. I'm not, and that has been a huge thing with the peptides, is kind of that 3 o'clock, whenever I pick up my kids, like I instantly get really, really tired. I'm like, man, I need a nap. That completely went away. So my whole day was just more productive because I had that sustained energy. But you can still sleep really, really well, which
Yeah.
is important.
100%, yeah. Thank you all for tuning in.
Yes.
Happy Easter to everybody.
Happy Easter!
And we'll put out another link for some questions. Maybe we'll do a live chat next time.
Okay.
Where people
Yeah,
can
and
call
we
in.
were basically just trying to finish hitting up all of these questions. So I
Yeah.
think we captured most of it in these first 2 videos, and then we can kind of progress. Like this was like a good, one-on-one, and now we can kind of dig deeper into some things. So
Yes. And just full disclosure, we didn't mention it in the beginning again, but at the end that I'm
Yes.
not your doctor. This is not true
She's
medical advice.
mine.
That's right. Would love to be yours too, but this is not true medical advice. So if you have any questions, please call your provider or doctor, or
Yep.
come see us for official medical advice.
that's it.
That's it.
See ya.
Bye.